There are currently no major traffic jams on the Metropolitan Expressway or general roads. Please drive safely.
It was a lovely, stylish hot spring. I want to go again.
It was. My skin feels so smooth now, I could go every week.
Now over to our reporter, Ms. Mitsui.
Yes, this is Mitsui at the scene.
Accidents that occur because of the driver's illness or deteriorating health condition are known as accidents due to health. These kinds of accidents have become more and more frequent in recent years. Brain disorders and cardiac diseases have long been thought to be the main causes of accidents due to health. But these are just the tip of the iceberg. There are believed to be many more overlooked causes. One of those hidden causes is sleep apnea syndrome. Sleep apnea syndrome is the cause of traffic accidents due to the driver falling asleep at the wheel. These kinds of accidents have become a major social problem in recent years. There are believed to be around 3 to 5 million people with SAS in Japan. However, because many people do not notice the symptoms, 90% of them are unaware they have SAS and remain untreated. Let's take a detailed look at sleep apnea syndrome, which has become such a problem in society.
I'm home.
Welcome home. You're back early today.
Is Kana still upset?
Do you blame her? You almost caused an accident because you fell asleep at the wheel. It scares me too, just thinking about it.
I'm so sorry about that, but I wasn't even a bit sleepy right before it happened, and I nodded off without realizing. It's not as though I hadn't been sleeping well either. It really did just suddenly come over me.
You say you're getting enough sleep, but you're restless every night. You let out these sudden loud snores, and it sometimes seems like you stop breathing for a bit.
Oh, really? I do that? Come to think of it, I've been waking up and going to the bathroom a lot lately.
Now that you mention it, our neighbor's husband was also stopping breathing while asleep, and when he went to the doctors, he was apparently told he had something called sleep apnea syndrome. Why don't you see a doctor?
A doctor? Well, I don't think it's that bad yet.
What exactly happens to the body with SAS? Let's learn more about obstructive sleep apnea syndrome. This is a schematic diagram of the upper respiratory tract or airway of a person sleeping face up. Normally, the upper airway does not close and airflow is maintained. However, in a person with obstructive sleep apnea syndrome, the throat and tongue muscles relax and hang down. This completely obstructs the upper airway, which is the passageway for air to pass through, and so the person's breathing stops. If breathing stops due to an obstruction of the upper airway, the body does not get enough oxygen. The person then wakes up frequently while sleeping in order to open the obstructed upper airway. These brief and repeated intervals of waking up during the night result in a light sleep overall and diminished quality of sleep. Poor quality sleep every night causes the person to suddenly become very sleepy during the day and then fall asleep soon after. Microsleep is when a person falls asleep for a moment without feeling sleepy beforehand. Because there is no warning sign of feeling very drowsy before suddenly nodding off, these microsleep episodes can easily cause traffic accidents if the driver falls asleep at the wheel. There are 7 features of SAS patients that I would like to cover. First, they snore loudly. They also have difficulty breathing while sleeping and have been told by others they sometimes stop breathing while asleep. SAS patients wake up to go to the bathroom frequently during the night and may also have a headache or other discomfort when they wake up. They also feel drowsy during the day, even though they think they should have had enough sleep. Additionally, because SAS diminishes the quality of sleep, even though they generally don't feel drowsy, a person with SAS may suddenly nod off, almost like blacking out. Chronic fatigue and poor concentration are also associated with SAS. Many people with SAS do not have any subjective symptoms, and even those with severe SAS don't notice any drowsiness, so caution is needed.
Hello, Mr. Shimoda, how are you? Aren't you eating a bit too much for your age?
No way! I have to eat at least this much to be able to do my job.
Well, I had a health check the other day and was told to cut back on fried food.
What, you're only 30 and already worried about your health? At your age?
No, Mr. Shimoda, you're not concerned enough about your own health. Really, if you don't take care of your health now, you could develop a lifestyle disease.
Really? Is that so? Actually, my wife told me the other day I should get a checkup at the hospital. Maybe I should.
SAS does not only cause drowsiness and sudden dozing during the day. Currently, a great deal of attention is being paid to the association between SAS and lifestyle diseases. Recent studies have indicated that compared to a healthy person, a person with SAS has from twice to 4 times the risk of developing high blood pressure or hypertension or diabetes, suddenly dying, or having a stroke or brain infarction. The risk of developing these diseases increases even more if the person with SAS is also obese. It's easy to think of SAS as a disease that affects overweight people, as being obese causes the upper airway to become narrow. However, there are also people who are slim but still have severe SAS. This disease is common in slim people with a small chin and similar features. When small-chinned people sleep face up, it's easy for the base of the tongue to slip down deep into the back of the throat, which narrows the airway. Also, our throat muscles become looser as we age, and alcohol loosens these muscles as well, so drinking alcohol makes it easier for apnea to occur. Obese people are particularly susceptible to this kind of obstruction of the upper airway. Fat accumulation around the neck puts pressure on the airway, and being overweight makes the tongue larger as well. So it's easier for the base of the tongue to slip down deep into the back of the throat. If you've been told that you snore loudly, or if you feel drowsy and fatigued during the day, you should get a checkup and have tests done at your nearest specialist medical facility.
Traffic accidents caused by the driver's health condition? Sleep apnea syndrome, SAS. Do I have SAS? What does that mean? Let me read more about it.
These are the results of a survey conducted of around 3,000 people renewing their driver's license about accidents caused by falling asleep at the wheel. The survey results show that compared to all respondents, the accident occurrence rate was around 3 times higher in respondents diagnosed with SAS. When asked for more details about what happened, the respondents involved in traffic accidents made the following kinds of statements. When I was stopped in traffic, before I realized there was a space in front of my car. Before I knew it, I had collided with the car in front that had stopped at a red light. According to experts, these admissions of before I realized and before I knew it are indicative of the dangers of SAS without drowsiness. Feeling extremely drowsy during the day is thought to be one of the symptoms of SAS, but having SAS does not necessarily mean you feel noticeably sleepy. So why do some SAS patients not notice that they are drowsy? There are thought to be 3 main reasons. First, If you generally lead a very busy life, you may mistake drowsiness as being chronically exhausted. Second, a chronic lack of sleep dulls your sense of drowsiness and makes it difficult to recognize it. Third, a high intake of nicotine from tobacco and caffeine from coffee, tea, soft drinks, and other substances also affects your ability to sense drowsiness.
Drowsiness without realizing it. I can relate to that. Maybe I do have SAS. I'll go to the doctors and ask about it.
How can I help you today?
Sometimes I suddenly nod off during the day while working or driving.
I see. Are you sleeping soundly at night?
I think I'm sleeping well, but my wife says I'm quite restless while sleeping, and sometimes it seems like I even stop breathing.
Is that so? You may have a condition called sleep apnea syndrome, SAS.
So I do have SAS then?
Despite the many people who have SAS, a very large number of them don't have subjective symptoms. This makes SAS a very difficult disease to detect.
Oh, really?
Would you mind doing some simple tests to see if you have SAS?
Some simple tests? Yes, that would be great, thank you.
These simple tests to detect SAS can be done at home. With the flow sensor method, sensors are attached to your nose and mouth to record your breathing while you sleep, and to check the extent of no breathing or apnea and shallow breathing, hypopnea. The pulse oximetry method uses a sensor placed on your fingertip to check the blood oxygen level or saturation during sleep and measure the extent of apnea and hypopnea. The test data is analyzed at a test facility and the results are sent to the patient. If the test results show any abnormalities, you will need to get checked at a specialist medical facility and have more extensive tests done.
The simple test results showed that you have some abnormalities, so you will need to undergo more extensive tests. This involves an overnight stay at a medical facility, so we can investigate your sleep and breathing in more detail. But don't worry, there are various ways to treat SAS. For patients with mild SAS, using a mouthpiece is the recommended treatment. However, for you, Mr. Shimoda, the detailed tests showed that you have frequent episodes of no breathing. So I recommend continuous positive airway pressure therapy. It's also important to adopt better lifestyle habits. Do you normally eat and drink a bit too much on a daily basis? Being overweight and drinking alcohol can cause or aggravate apnea. If you want to fundamentally improve this condition, you should try to cut back on the amount you eat and reduce your alcohol intake. Tobacco also causes inflammation of the upper airway and other conditions, and is a cause of apnea, so it's important to stop smoking as well.
Oh, yes, for sure. I've been told I eat too much. What is continuous positive airway pressure therapy?
There are various types of treatments for SAS. The first and most fundamental treatment is to improve your lifestyle habits. You can also use a mouthpiece for mild SAS. Continuous positive airway pressure, or CPAP, is the most commonly used treatment for SAS. Patients use a CPAP machine at home while they sleep. A mask and hose from a CPAP machine are used to pass air through the upper airway. This continuous air pressure keeps the upper airway open. The mask is attached to the CPAP machine via the hose, and when placed over the nose, air from the machine passes through the upper airway with the proper amount of pressure. The air pressure stops the upper airway from collapsing during sleep and prevents no breathing and shallow breathing from occurring. The CPAP machine only stops the upper airway from collapsing. It doesn't breathe for you. You are still breathing on your own as usual. Proper use of CPAP therapy can reduce apnea and hypopnea during sleep, lead to better quality sleep, and improve the symptoms of SAS such as drowsiness and poor concentration during the day. Also, CPAP therapy is covered by health insurance. You just need to get tests done at a hospital and meet certain criteria. And remember, being overweight narrows the back of your throat. So along with treatments such as CPAP therapy, it's also important to exercise and try to lose some weight. You should continue with CPAP therapy, and you must get regular checkups and come to the hospital regularly.
You haven't been snoring as much recently. You also seem to be sleeping more soundly, too, and you have more energy during the day. The CPAP therapy is working. You've been jogging as well, and it looks like you're losing some weight.
Yes. I also feel like I'm sleeping better these days. I feel rested when I wake up, and I don't go to the bathroom at night as often as I used to. It feels good to exercise, too, and it's easier to move around when I'm carrying less weight.
Hey, Dad?
Yes, Kana? What is it?
I have a favor to ask you.
I've been continuing with CPAP therapy and improving my lifestyle habits, and I'm able to sleep soundly at night. I don't feel sleepy at all or lacking in energy during the day anymore. I'm able to concentrate at work, and that's being recognized at the office. And more than anything, I'm confident I can keep my family happy and safe. That's what motivates me to live. I'm so glad I went to the doctor to get checked out for SAS. Kanna, Marie, we're almost there.
Yay! I've been wanting to come to this hot spring again as a family.
Thanks to you focusing on treating your SAS, we're able to feel safe in the car with you. I'm so happy.
Let's enjoy the hot spring and lots of delicious food.
But let's also be careful not to eat or drink too much, okay?
Really? Are you serious?
With the proper treatment for SAS, you can sleep soundly again. The most dangerous thing you can do is to not treat SAS. Getting tested for SAS can help with early detection and early treatment. This will not only improve your health, but also help to prevent traffic accidents from occurring. SAS is a common disease, but there are few subjective symptoms, so many people with SAS remain untreated. If you know anyone who may have SAS, please encourage them to get checked at a specialist medical facility and do some simple tests. Early detection and early treatment are important to help keep you driving safely and for a long time.